Dr. Amin.
Everybody, this is Wesam Shams from Ophthalmology Department, Tanta University. I'm here today to present the paper of the impact of COVID-19 on individuals across the spectrum of visual impairment. To introduce about the paper, coronavirus disease 2019 or COVID-19 was declared as a pandemic by the World Health Organization on March 11, 2020. The disease and its consequent shutdown brought various challenges to patients with visual impairment who were seeking eye care either electively or on an emergent basis. Analysis revealed that ophthalmology lost more patient volume than any other specialty during the acute phase of COVID-19 in the United States and possibly worldwide. So the purpose of this study was to assess the perception and implication of COVID-19 on patients and their caregivers across the spectrum of visual impairment, as there is currently no evidence regarding differences in the perception of COVID-19 between visually impaired individuals and those with normal vision. So about the study methodology, we performed this prospective cross-sectional comparative study based on telephone survey from July 20, 2020 to August 15, 2020. Using the medical records database, we obtained demographic data, ophthalmic findings, diagnosis, best-corrected distance visual acuity, and telephone numbers of patients who presented to Arvind Eye Hospital in India between July 2019 and February 2020. Patients were consecutively recruited from the database based on their registration date until the planned sample size was achieved. So inclusion criteria included being an established patient, age of 18 years or older, active telephone number, and fluency in the regional language, and willingness to participate in the survey. While exclusion criteria included incisional surgery or laser procedures performed outside Arvind Eye Hospital, presence of neurocognitive disorders, status as a healthcare workers, as this group may be more familiar with the COVID-19. So about the study groups, we categorized patients into 4 groups based on the degree of their visual impairment in the better eye as shown in Table 1, into blind, severe visual impairment, moderate visual impairment, and no or mild visual impairment. Those with moderate severe visual impairment or blindness were considered as case groups, while those with mild or no visual impairments were considered as controls. In patients with multiple diagnosis, the diagnosis with the more advanced disease state, presumably responsible for greater visual impairment, was considered the primary. We also interviewed caregivers who the patients identified as being responsible for their basic needs. Regarding sample size calculation, a pilot study was performed on 40 participants, each in 10 in each category, to validate the survey questions, assess feasibility, and calculate sample size. During the phone call, survey details were discussed and participants were asked to provide oral consent. To allow for 80% power and an alpha of 0.05, an estimated 2 and 32 participants were required to identify differences among varying levels of visual impairment and regarding to obtaining information about the COVID-19 and perceptions regarding vision as a risk factor for disease contraction. So the results. The characteristic of the study groups, we identified 470 eligible participants for the study and made contact with 248 households. Of this group, 10 individuals declined participation and 6 individuals has expired. The questionnaire was completed by 232 participants with 58 participants in each group. The baseline characteristics are represented in Table 2. So the most significant results regarding the baseline characteristic was that older patients were significantly more visually impaired, while controls were more likely to have graduate degree. The frequency of irreversibly blinding primary diagnosis varied amongst the groups and were most common among blind participants, 81%, and least common amongst control, 0%. So given the survey was very long and the questions were multiple, herein we present the most significant results. So upon asking the patients about taking preventive measures like avoid leaving home, wearing mask, frequent hand washing, and social distancing, here we noticed that blind participants less commonly wore masks while control more commonly performed hand washing. Upon asking the patients about the vision and the relation to COVID-19, like, do you feel that your vision may put you at a greater risk of contracting COVID-19? Do you feel that your vision may put you at a greater risk of poor outcomes if you contract COVID-19? And do you feel that your treatment may put you at a greater risk of contracting COVID-19? We noticed that blind participants more commonly felt that their vision may put them at a greater risk of contracting COVID-19. Upon asking the participants about other concerns during the COVID-19 shutdown, like access to information about the virus, maintaining a job or schooling, access to food or groceries, access to healthcare, and interacting with others in a social distancing, in social settings, and transportations, we noticed that blind participants more commonly had concerns about access to healthcare and more commonly had concerns about interacting with others in a social settings. To summarize the most significant results of the survey, we found that blind participants more commonly perceived the vision as a risk factor for contracting COVID-19, were concerned about access to health care, obtained the news through word of mouth, and less commonly wore masks, while controls more commonly performed frequent hand washing, were aware of telemedicine, and had fewer concerns about social interactions compared to groups with substantial visual impairment. All caregivers reported more frequent patient care since the COVID-19 began. So the conclusion of our study, assessing patients' perception of COVID-19 and its regulation is especially important with groups of severe, moderate, or worse visual impairment, as limitation and concerns significantly differed in these groups. This survey demonstrates that those with blindness had greater concerns about their visual disability, putting them at a greater risk of virus contraction, had more difficulty in adhering to standard preventive measures, and were at greater risk of receiving incomplete news as they relied on word of mouth. Visual limitations may have been augmented by concomitant hearing impairment and older age. The pandemic response must include individuals with visual impairment and other disabilities, as evidence-based assessment inclusive of all populations are necessary to demonstrate a potential disproportionate impact of COVID-19. This paper was published as a original article in the American Journal of Ophthalmology, and please feel free to ask any questions and contact me via email. Thank you so much.